Have you ever noticed red streaks running up your arm or leg after a small cut? Or maybe your skin feels hot, swollen, and tender, like it's angry. That could be your body's drainage system sending out an emergency alert. Just like roads help traffic flow, your body has tiny tubes called lymph vessels that carry a clear fluid, lymph, to fight germs. When these tubes get infected or inflamed, it's called lymphangitis. And when it hits fast and hard, it's acute. When it keeps coming back or lingers, it's chronic. Think of acute like a sudden storm, and chronic like constant drizzle. Both need attention, because ignoring them is like letting a small leak flood your house. What causes these angry red lines and swelling? Let's play detective. Imagine you step on a rusty nail or get a cut while gardening. Bacteria like Streptococcus or Staphylococcus sneak in through that tiny break in your skin, like thieves entering an unlocked door. They travel into your lymph vessels and start a riot. That's acute lymphangitis. It's often from sudden infections. But what if you keep getting these flare-ups? That's where chronic lymphangitis kicks in. It might be due to repeated infections, long-term skin conditions like eczema, or even blockages from surgery or obesity. For example, if someone had breast cancer surgery and lymph nodes were removed, their arm might swell and get infected more easily. That's a setup for chronic trouble. So the cause, usually germs taking a shortcut through your body's cleaning system. So how do you know it's lymphangitis and not just a sore muscle? Let's test your body's clues. Do you see red, warm streaks moving from a cut up your arm or leg, like a road on a map leading away from the wound? That's a classic sign. Does the area feel painful, puffy, and hot to the touch? Are you running a fever or feeling shaky like you've got the flu? These often come with acute lymphangitis. Imagine you cut your finger, and a day later, red lines race up your hand, and you feel terrible. That's your lymph vessels screaming for help. With chronic lymphangitis, the redness might come and go. Your skin may thicken like tree bark, and the limb might stay swollen. Some people say their clothes or rings don't fit right anymore. If you're noticing repeat episodes after small injuries, your body might be sending recurring distress signals. How do doctors know it's lymphangitis and not something else? First, they'll ask, where's the wound? When did the redness start? Do you feel sick? Then they look at the red streaks, like tracing a path on a map. They may check your temperature, feel your lymph nodes, small bean-sized cleaners in your neck, armpit, or groin, and maybe take blood or swab the wound. Imaging, like an ultrasound, can peek under the skin to rule out a blood clot, because that can look similar but is way more dangerous. Treatment, if it's bacterial, which it often is, antibiotics are the heroes, taken as pills or, in severe cases, through an IV in the hospital. Rest, elevate the limb, prop it up like a foot on a stool, and use warm compresses, like a soothing tea towel on your arm. For chronic cases, doctors might suggest compression sleeves, like athletic wear that gently squeezes, or skin care routines to avoid future cuts. Think of treatment as both fighting the current fire and building fire-resistant walls for the future. Can you stop lymphangitis before it starts? Yes, and it's easier than you think. Start with simple habits. Wash cuts right away with soap and water, like giving your skin a quick shower after a scrape. Use antiseptic cream and a bandage. Imagine you're a superhero, protecting your skin fortress. If you have athlete's foot or dry, cracked skin, treat it, because tiny breaks are germs' doorways. Keep skin moisturized, especially if you're older or have diabetes. Wear gloves while gardening or washing dishes. If you've had swelling in a limb before, wear compression garments as advised. It's like wearing a seatbelt, just in case. And if you see redness spreading after an injury, don't wait, see a doctor fast. Prevention is about being a step ahead, not waiting for alarms to go off. Science is always learning. Recently, doctors are using better imaging and faster tests to tell lymphangitis apart from blood clots, which is super important because treatment differs. Some studies are looking at how the body's immune response overreacts in chronic cases, like a smoke alarm that won't turn off. New research also explores how skin microbiomes, the good germs on your skin, might help prevent bad ones from invading. Imagine good bacteria bodyguards protecting your skin. There's also growing focus on lymphedema clinics, where specialists manage long-term swelling and reduce chronic lymphangitis risk. Telemedicine now lets people send photos of red streaks for quick advice. No waiting room needed. The future, smarter, faster care, with you in the driver's seat.